Great. Hey, everybody, I'm Patrick, and we've got Adam in the stream here. We're going live now with our webinar discussion about vaccine mandates and nurse recruitment. So, we are definitely in an unprecedented time of uncertainty for nurse recruitment, and we want to just have a discussion about this topic because we've been hearing about it from our clients in healthcare and from nurses. And we know that many of you are very interested in this. So we're just going to warm up here as people are joining the stream. My name is Patrick Thiele. I'm the Chief Operating Officer at Applichat Healthcare. We are a recruitment process outsourcing company, and we specialize in sourcing passive nurse candidates from non-job board channels. If that sounds interesting to you, please connect with me on LinkedIn or send a message here in the chat, and we can follow up and talk to you about how we do that and how we help our healthcare clients to get more nurse applicants. So as I said, it's a very uncertain time in terms of nurse recruitment and retention due to the current discussion around vaccine mandates regarding COVID-19. We've been hearing from our clients and others in healthcare that they're starting to see nurses resign due to vaccine mandates, and they expect to see resignations continue to grow for some time as the mandates roll out. We're also hearing from a lot of nurses in the recruitment that we're doing with questions about vaccine mandates and whether the employers that we're recruiting for and working with are going to be requiring vaccines. So today we want to have a conversation about this. We want to discuss how vaccine mandates can affect hospitals and other healthcare employees. We want to discuss how nurses are reacting to this. We want to also explore how employers of nurses are reacting to this, and to talk about some samples of what we're seeing out there in the community. And we want to explore how you can communicate your position on vaccine mandates to current employees and candidates. So I am going to turn over the mic right away here first I want to mention, you can see at the bottom of the screen, our Nurse Recruitment Secrets Facebook group. If you're in nurse recruitment or nurse management, please join our Facebook group for information and connecting with other people in nurse recruitment on Facebook. It's a great place to connect and get more information. And I'm going to now turn the mic over to our president of Applichat Healthcare, Adam Chambers, who will jump into our topic today. Over to Adam.
Okay, thank you very much, Patrick. So yeah, welcome along, everybody. I'm going to share my presentation and we can begin. Big shout out to Nicole Falstich. Facebook told me it's your birthday, and I know that you come to our webinars a lot, so happy birthday. Welcome along, everybody else. What we're going to talk about is something that lots of nurses are talking about. So the reason that I had an idea to do this was because we put up a job ad on Facebook, and usually the comments are criticizing the ad, or criticizing the employer, or saying the employer's great, or saying the ad's great. They're not usually about stuff like this. So we were just bombarded with nurses commenting about vaccine mandates, and you can see it's a very emotive topic, and it's something that nurses are speaking about. And as recruiters, we are really the irreplaceable link between the employers that we work at and those nurses. So it's imperative that we are tuned into this conversation, because we are both ambassadors of our brands and then representatives of these nurses to our brands. And every nurse who speaks to me says that transparency is the most important thing for them, and we have to be transparent about it. So that's why we're doing this. What we're going to talk about are some of the facts of the situation. So consider that a 60-second news bite, so you don't have to go and research it yourself. I'll tell you why it's important, and then share 8 things, but I think it's 10 now because I had new ideas before this, that you should know about the situation. Finally, we'll have some audience contributions. So I'm going to invite you to share a comment on some of the tips or some of the strategies for responding to this that your organization and team are doing. Before we get started, I just want to tell you how to use this information. So it's not really from a legal perspective. It's more from a informational perspective. So it's a very moving situation, and I don't want you to take any comments I say and go away and implement them and for something brash to happen. So just a little bit of a disclaimer there. I've chosen to just take the facts that have been shared by the government or news outlets and gain from things that our clients have told us and nurses have told us as well. So without further ado, whenever it comes to a vaccine mandate, what we're essentially dealing with is on two different levels. So there's a mandate by a private corporation, which is the employer, that all their employees should be vaccinated against COVID-19. And then there's a mandate by the government that everyone in an organization of that size needs to be vaccinated. So the difference here is really in how you approach and explain the topic, because it's very different to say, we as an organization are standing firm and really value the security and the solutions which vaccine provides, compared to saying we have to implement this because the government are telling us. What I'm going to focus on today is the government mandated vaccine and what that means to you. Because a couple of weeks ago, again, this is just going to be for the USA. A couple of weeks ago, the president announced that there would be the requirement for, number one, healthcare workers at Medicare and Medicaid participating hospitals and other healthcare settings, and then workers at organizations with 100 or more employees to ensure that they're vaccinated or tested weekly. And most of you are going to fall under both of these brackets. So unless you're a really small healthcare organization, you're going to be brought into the second part particularly. That's what's been announced, okay? That's the fact of the situation. And there is some precedent for this. So 1905, there was a smallpox epidemic, particularly in Massachusetts, and Jacobson, this fella, he brought it to the local court that he didn't want the vaccine to be mandated. It was against his constitutional rights. Eventually, it found its way to the Supreme Court, these gentlemen in the middle, and they legislated, well, they made it clear that the government could actually mandate vaccines. So these are kind of like the basis that this is coming out on. And it is really important for us. So I know that it's important to be a positive thinker and to believe that such matters won't be an issue for us, but I think everyone on this call knows this already. That's why you've came to the call. But you should share with your colleagues that this could actually be harmful for you. So this is a hospital that had to close its maternity ward because of the vaccine requirements. So you can see here that there's a 30 employee resignation rate from the Lewis County General Hospital, and 5 times that number haven't been vaccinated and they don't know what their plans are, or they haven't shared what their plans are. So this is important, and this is something to take notice of. And as I mentioned, as recruiters, we're that link between the employer and the candidate, and we should be sharing with our employers what we're hearing from nurses who are applying to positions. And finally, for this introduction, just because nurses are nurses doesn't mean that they all will take the COVID vaccine. So this is happening in other sectors, first of all. So in Chicago, bus drivers have quit. It's also happening in nursing. So I'm going to share this presentation after for those who want to see the sources. But as you can see here, Pulse in the Nation's nurses surveyed almost 13,000 nurses, and the majority said they were unsure or they didn't know if they would voluntarily vaccinate themselves against it. So on these figures, I know that the rate in the population as a whole is touching 60%. So I think this is going to be higher because most of these nurses probably have taken the first dose. But it just goes to show that we shouldn't really dismiss this as being a potential issue to losing staff or staff not wanting to work, because it's being shown that even though nurses are facing COVID each day, there's still a measure of hesitancy amongst them. So what can you do about it? What are you going to come up with to, number one, avoid nurses not wanting to apply to you because there's a vaccine mandate, and number two, stop current staff leaving? And the whole thing about this is it's all up in the air. It's a really changing situation. Some states are challenging it in the courts, and nobody really knows what it's going to look like in 2 weeks. Obviously, if there's a mandate across the state that you're in, for example, then nurses who work in hospitals and haven't got that vaccine are going to have to make a choice between getting vaccinated and leaving their profession. So you could expect that when push comes to shove, they will take it, but we just don't know. So that's why it's important to have a structured plan. And I found that this company, Cielo Talent, really laid it out very well. Again, get the presentation off me and you'll see all the sources. But they said to think about it in 4 different steps. So number one, mapping the impact on your talent strategy and hiring process. So that means communicating with your current nurses and your candidates to find out what % of them are vaccinated and to find out what the vaccine mandate is going to mean for them if it comes into play. Now, that could be done just by adding in to your application form a question. Now, you have to be careful how you word the question, but a question which gets information from the candidate market on how they're going to react to this. The initial step is all about building a base of data so that you can then go on to work alongside the other stakeholders in recruitment and HR as a whole to develop a policy. And unfortunately, in HR, we don't have a massive measure of control on the higher level policies of an organization. So if a hospital system is going to choose to mandate the vaccine or not, often there's going to be many other stakeholders who are brought into that decision: CEO, CFO, COO. So what we really have to do is be the communicators of that in the way that we know works when speaking to nurses. So to have a positive communication strategy in HR and recruitment, which interprets and presents what the grander policy is in a way that is both transparent and empathetic and clear to candidates and current staff. And as I mentioned at the start, nurses want transparency. So I think, given the sensitivity and the interest around this topic, that you should be talking about it in your communications. So if your organization is mandating vaccines, you should be explaining why you think that's important as an organization and how that plays into your culture and why it matters. Because what you're going to do is make that picture of the hospital more developed with more color, and it's going to invite and attract the nurses who are drawn to an organization which stands by its values and makes it clear to everybody where they stand. On the flip side, if notwithstanding the government mandate, your organization isn't mandating the vaccine, then again, explain why that's the case. So have structure here. Don't just wait for the lights to be switched off, so to speak. Have a strategy in place at whatever level you're at. And if you're going to follow the state of the mandates coming from the government, my recommendation is that you do it on a state level. So the reason for that is there's a lot of legal challenges to this at the moment, from both, well, this particular challenge was from a group of doctors and nurses who were Christians, and they said that they did not want to take it for religious reasons, and then a judge in New York suspended it for healthcare workers who claim religious exemption. So there's legal challenges to this across the country, and it's really best if you follow what's going on in your own state, because that's the level which the challenges are most likely to be made, given that, as I said, there's precedent on a national level. So follow what's going on in your state. And this calls a little bit back to the structure of the plan. Take action on what you can control. So go deep into how, as a recruitment department, you communicate your response. And then whenever you're speaking to candidates, take action on that. You can control that. You have agency there. You're one of the most important communicators of the policy at this level. It's not how the mandate affects you, because if it comes from the government, it's going to affect everyone the same. It's how you communicate that to your candidates. So communication is really key, and focusing in on what you can control instead of worrying what you can't control at the top. And then be prepared. So see here that already we have developed a database of nurses' concerns and responses, so that we can, whenever formulating our response on the phone, have it already prepared. So have it written out, not as a script, but as a framework on what we're going to talk about, what we're going to touch upon. So you can see here they're asking, do I need the COVID shot, or what's the vaccine status? We're going to make a response which takes into account what the nurses are saying to us. So that's why, as I mentioned, it's important to go out to your current employees and prospective employees and to find out what their thoughts are on the topic. Preparation is really key. And also, it's good to know what the colleagues and the competitors that you have are doing. So keep a watch out for the larger healthcare systems, because they'll probably be in the news on what they're doing. For example, as of the 9th, HCA, which is the largest health system, isn't requiring vaccines, but KAISER, PERMANENTE are requiring vaccines. So if you're looking for inspiration on how you can respond to this, then just do a Google search of these organizations or your local competitor. And if they're not doing anything, then it's probably a good idea for you to do it, because transparency is going to be favored by the nurses. So look at what other people are doing and take inspiration from them. You're not in this alone. as I showed you at the start, the bus driver recruiters in Chicago are facing this as well, and this is going on for companies across the country. And I know in nurse recruitment we're particularly challenged by number one, the shortage of candidates. So if there's a vaccine mandate and there's anti-vaccination nurses, there are going to be less people who can work for us. And then also there's heightened competition as well, because there'll be less nurses to go around. But other organizations and other recruiters are facing this, so you don't have to go it alone. And whenever you're going about formulating your strategy and communication and response, network with other people in your state and find out how they're responding to it. Connecting with other people is going to be very important for going into unknown territory. Now we're coming to the final points. I picked up on this. It was in the news. CBS picked it up and the New York Times picked it up, that this health system in Nebraska contained this point of no mandated COVID-19 vaccination. So, as I said, it's important to be transparent about this, but be careful on what you say. So, the issue for the news people with this was that they were arguing that to not be vaccinated was dangerous, and that this was almost encouraging that that choice. So I know that there's a lot of polemic involved there. There's a lot of opinions involved, but you just have to be careful, because the last thing you want is a recruiting department advertisement approved by the recruiting department showing up on national news, and then you've got everyone knocking on your door asking why your health system's in the national news for negative reasons. So be careful, but at the same time, I mean, be transparent about it. So if you're not going to talk about this in the job ads, and I don't think you should do it so clearly like this, then it's something you can talk about when you're phone calling nurses and really address what's going on, educate them, because remember, if a nurse has come through your website and applied to you, they've probably applied to 3 or 4 other places. So if you're able to stand out and communicate to them in a unique way that no one else is doing, then they're going to trust you more, and they're going to be more likely to want to continue the application with you than someone who says nothing, or whenever they're asked says, yeah, I don't know, I'll have to check on that. Have something prepared, because this is something that nurses who aren't vaccinated care about. Lastly, to summarize, if in doubt, just tell the truth. So tell the truth about what your organization is doing, why it's doing it, and even whenever it comes to creating a strategy for this, everyone should be transparent about what might happen, what could happen, and in that way, you're going to come up with the clearest ideas. So really, to summarize, I think the key point here is that nobody knows what is going to happen in the next month or so with this. In a worst case scenario, nurses who aren't vaccinated are going to stand firm, and we're going to be facing a situation where there's even more shortage. And in a best case scenario, nothing changes. I know I was trying to think of a way that our staffing situation in nurse recruitment would improve, and I don't think that this is going to affect it positively in any way. But I hope this has been useful and given you some points to think about. I'm going to stop sharing my screen, and we're going to bring in a little bit of audience participation. So Patrick, do you want to, I'm going to add you to the stream, and do you want to pick up on the comments?
Sure, I can do that. So Matt, I had asked the group, and people should feel free to add more comments, questions, and input on what's happening in your workplace, how your workplace is being impacted, and also if how your workplace is responding to it. Matt and Rama both made the point basically that the recruitment job is about selling the job, selling the organization, and explaining why the organization has a certain rule, certain mandate. Matt says you can't change a person's mind, but you can educate around the reasons behind it and hope that it will work for them and they will be willing to join the organization. Bina asks about HCA, and if there's anything more you can say, Adam, if you learned anything more about HCA and how they're able to not follow the mandate at this point in time.
Yeah, so as I said, this is changing very quickly. The article I picked up on was from a week ago, and really that they can't avoid the government mandate. So for now, they're saying, like, as an organization, we're not mandating this, but if the government say they have to do it, they're going to have to do it. I mean, personally, it could be interpreted by like how do I say this? It could be like a PR move, right? So 1 week before any vaccine mandate comes in, they say, no freedom of choice. We respect nurses' ability to make their own decisions in life. 1 week later, vaccine mandate comes in. Well, we have to do it now because the government said. So that way, they're really covering both bases and appealing to both audiences. I don't know if that's the reason behind it, but if I was a PR guy, then that's probably what the strategy I would do. Matt says they'll be hurt long term.
That's right. Yeah. So I posted another question there. I'm really curious how people are seeing their workplaces being affected, both by nurses that are either thinking of leaving or are leaving or are not coming in. And as I said, we're hearing from our clients and others that we talk to in healthcare that it's really happening. Like nurses are asking, and nurses are actually resigning already. So that's definitely coming down the pipe. So if people want to add questions, add comments about that, that would be really interesting for us to hear some more feedback on.
Yeah, absolutely. I think we've been working with one organization, and their message at the moment is we're not going to mandate anything, but the government might. So whenever we responded to those comments I showed you and said that there's not going to be a mandate, the nurses responded positively. But I think, I know this is just a thought and a feeling, but I think generally the vocal minority of nurses on this will be leading how we respond. So we'll see the comments, say 10 comments saying about vaccine mandates being an issue for them and they're going to leave the profession. But there's a lot of nurses behind them who have been vaccinated or will get vaccinated.
Yeah, that was my thought, that the nurses you're hearing from that are saying they're responding positively when there's no mandate are the ones that don't want to be vaccinated. But there's a lot that obviously have been, and Matt makes the point that why would the ones who are vaccinated want to work where there is a no vaccine mandate if vaccines are important to them? Yeah, really interesting.
Yeah,
challenging.
it's like unprecedented and something that is just an extra issue to be added onto us. It seems that we're sort of being hit unfairly.
And it's also
COVID.
really, yeah, that's right. It really, healthcare obviously
By the world, I mean, I'm not saying the vaccine mandate is like a good or a bad thing,
And I think for HR in a larger organization that works across borders or in multiple states, it's even more complicated because suddenly an organization, well, they're used to looking after policies from different states, but suddenly you've got a hot issue that's live today, and every state is dealing with it in slightly different ways. So that complicates it, at least at the beginning, as the states are figuring out how they're going to respond to this.
Hmm. Yeah, and it's a doubly emotive because we are working with nurses, and they've been the ones who have been dealing with COVID patients all the while. So
Right.
it's important to be careful if you're on the phone to a nurse of what you say, because I get the picture that because of the emotion around this, a lot of the anti-vaccination nurses are sort of touchy about it, and you don't really want to trigger like a negative response from them, like saying, "Okay, I've saved people's lives, COVID, blah blah blah. I don't believe in this." I'm gonna bring in a comment from Kathy on LinkedIn. So she said, "I use my own personal reasons for working at an organization. Same with the vaccine. I share why I took the job. Nurses like honesty."
Mm.
Yeah, I think that's a good summary for this.
That sums it up. Yeah.
Yeah. Um, Patrick, what do you think is going to happen if everywhere has a vaccine mandate and um, the nurses have to really make a choice? Do you
Well, I think
foresee like a challenge for?
Yeah, I think that once the mandates, if they become global in terms of state by state or across organizations, that will actually make things a lot easier for the organizations because then you're not struggling with whatever your own local policy is. You're not struggling to compete against another organization's policy if everyone's got pretty much the same policy or following the same mandate. So I think that will be easier that way. Certainly, some nurses are not going to be happy with that. And some will leave the profession, of course.
Mm,
But probably there's also going to be a cohort of those nurses that will choose if they want to keep working, if they need to keep working as a nurse, they will get the vaccine and be able to fit into that local policy. So I think that would make it easier down the road. But I think we're going to be in for a bumpy road for the next little while in terms of the questions and perhaps nurses bouncing around or considering bouncing around organizations to try and find a
mm,
place where they feel like they fit.
mm,
So in terms of the nurse shortage, it's certainly not going to get better anytime soon with this thing happening. The nurse shortage is still a hot topic. A few months ago, I recall in the late spring, some people saying they thought that things were getting back to normal in terms of nurse recruitment, starting to get back to normal, but that certainly changed again with the fourth wave coming to fruition, and that now this issue complicating things. So the nursing shortages doesn't seem like it's something that's going to turn around anytime soon,
mm,
sadly.
mm. I hate how that sounded. Fourth wave.
Yeah,
It's like when's it gonna end?
yeah.
Yeah. Um. Okay. Well, if anybody else would like to contribute to this, just put a comment down below. But in the meantime, I have put the presentation for this into the comments, so you can click that, and you'll be able to see the sources for this. And if you're going about formulating a response or a strategy that's going to help your organization go through this stormy period, then we'd love to hear what you're doing. So there's our Facebook group
Hmm.
where you can join and you can tell us what your plans are, and maybe learn from others what they're going to do about it as well.
Yeah, great. I put the link for the Facebook group right there in the chat, so you can just click on that or search Nurse Recruitment Secrets that's on the screen there. Yeah, hope you'll join. We've had a few people join already since we started the webinar, so that's great.
Awesome. Um, I'm going to bring up one more comment from Rama. She said, We are encouraging nurses to get the vaccine, but giving flexibility until government mandates are implemented. So she referenced the why that they have, and that's what I'm getting from the comments here. That's what Kathy shared as well, that you have to tell them why. They like honesty. It's what's important to them. It seems like there's two main strategies at the moment if you're looking for inspiration. There's strategy number one: tell them that as an organization, this is our why, this is our mission, and mandating vaccines is part of that mission. Don't say the word mandating, but say like the fact that all our nurses are protected against COVID-19 so we can protect our patients is extremely important to us. That's number one. And number two is the organizations like HCA, who for now are saying we encourage everybody to get the vaccine, but we respect their personal opinions. But that could soon be changed by a government mandate. And as I mentioned, perhaps that's going to be appeasing to people who don't want vaccinated, and so it's less of a strong standpoint against it. But at the same time, it could be interpreted as Matt said, as preferring profits over caregivers. So that's about it for this this webinar. Patrick, do you want to say any closing remarks?
Yeah, just to, as I said at the beginning, if anyone's interested in how we source nurses from passive channels outside of job boards, please let us know. Connect with me on LinkedIn. I just put my LinkedIn link in the chat, so check in with me there, connect with me there, and we can tell you more about that. And a reminder that we do host webinars at least every couple of weeks, sometimes more, on all regarding nurse recruitment and retention. So please join us and stay in touch through following our Facebook group and our LinkedIn page and connecting with me on LinkedIn. I think that's it.
Great. Thanks for coming, everybody. See
Thank
you later.
you.
Bye.